When I was running Mercer and Marsh benefits in the 14 countries across Asia Pac, we actually grew 800%. But despite that growth, our clients complain incessantly. So what were their pain points? The first thing that companies told us was that their costs were rising double-digit every single year. And that makes sense because their employees were aging and because of chronic disease. Chronic disease in Asia actually comes 10 years earlier than the West and at a lower BMI. So companies started offering wellness initiatives to actually combat this. But you know what they noticed? Only the super healthy and the triathletes came to their courses, while the sedentary and the obese never came to the wellness initiatives. So the healthy got healthier, and the unhealthier got worse. Then when we actually talked to the employees, what did they say? They said, hey, look, one size fits all. Why do I want that much, especially young people? Because with the young people, they think they're invincible. And then when you talk to dual income couples, they're already covered by their spouse. So what good is this benefit? The other complaint that we heard from employees was that no one could ever find a receipt. So they submit a receipt for going to a doctor or a hospital, and you know what? No one could find it, and no one could reimburse them. So the burden on HR was pretty horrible. And then the companies complained to us, hey, why are there so many vendors and no data? And if you look at the entire value chain, you can see why it's so hard. It's completely fragmented. So an employee with a lost receipt would go to their HR. The HR would go to the broker would go to the insurers would search the clinics and the hospitals. And then if HR had wellness initiatives, they also had so many other vendors. So we figured out how to solve this using technology. And I try to convince my New York-based firm in 100 countries to just give me $10 million to invest in technology. But after 5 years, every year, repeatedly begging, they never said yes. So I found my husband's keys. I've never gone into his cabinet. So I find his keys, go into his cabinet, and find out that he has enough money, and convince him to give me the 10 million. So what happened? What if we do to employee benefits the same thing that the travel platforms did to travel when they aggregated the airlines, the hotels, the car rentals, and the travel insurance into one ecosystem? So it's about a trip. What if we did that to employee health and not just connected the insurance companies with the hospitals and clinics, but also the health screening, all of the health tech, the teledocs, the e-pharmacies, everyone in the entire health continuum, and connected the governments and academia. Like the School of Public Health that actually has built a framework for predicting from now to 2050 the prevalence of chronic disease here in Singapore. So why is that important? If we're able to actually upload the health screening and give it to an employee so that they know if they're at risk. And at the same time, connect them to a doctor and an e-pharmacist. This is important. One of my clients in China, based in Shenzhen, actually bought cancer insurance for their employees. But you know what happened? They found too many late-stage cancers. It was too late. So most firms only buy insurance. That's not enough. And my concept was simple. Why wait until someone is sick or hospitalized or diseased? Why can't you shift some of the money that's used for treatment and shift it to early detection and disease prevention? So you need this data in order to do that journey. And what if we're able to have a questionnaire given to employees about their lifestyle, their exercise, their sleep, what food they eat, smoking, drinking. No one ever tells us the truth about drinking. And we're able to age their face according to their lifestyle habits. So the more bad habits they have, the worse their faces look. This only works on women, unfortunately, because they care about their faces. Men see their faces, they think, oh my God, I'm still so handsome. I think men are delusional. So what we found that really works for men is if you take a picture of them in profile, in tight-fitting clothes, and you show them that they can look pregnant too. We also found that it's really effective if you take away their hair. Then they care. So it's not their face. And what if every time you go to a doctor outside of your network or to a hospital, we're able to capture that information, the diagnosis, the provider, the costs. And every single time you go to a provider, it's cashless. You don't have to look for that medical card, but it's a QR barcode so that we could actually track and you could see those records. So if we take all of this data, your health screening data, all of your receipts from the doctors and hospitals, your blood test results, and medical device data, hypertension, diabetes, and your demographic data, and your work-life event. With this data and with AI, we can finally pinpoint for you your risk of chronic disease, how much insurance you really need, what are the gaps in the overlaps in the coverage that's given by your firm, your goals, and then how do you actually get healthier? So if we could actually shift you from one size fit all to actually curating and personalizing what really matters to you in terms of your health and your protection, and pull out the educational articles you need so you can actually learn what to do. Because you only care about diseases you have. You're not really reading about every other disease. And what if when you exercise, or you lose weight, or you quit smoking, or you improve your blood test results, you actually get rewarded for better health. You're incentivized to be healthier. So if we had a wallet and monetize the value of your company's insurance spend and gave you control of that wallet and allow you to decide, just like Netflix, of all this content, but you control it. That means that you start taking personal responsibility for your own health. But what does that do for companies? With a fixed budget per employee, there's a fixed budget for the company. And they get to decide the incremental increase in that budget, just like they do for salaries. Instead of 25% a year because who knows what happened. So that means that with the same amount of money for companies, they not only can pay for treatment, but also for prevention. So each employee gets an amount, and companies can decide, do married people with children get more? Do more senior people get more? Do young and healthy people get less? Or is it the same for every single person because you believe in equality? And what the employee can do is we actually suggest for them, look, your spouse has already paid for your medical benefits because it's covered. They're also covering the spouse. So why can't you actually opt down and free up those thousands of dollars and use it for something that's more suitable for yourself, like mindfulness or smoking cessation or things for your kids or your parents? Why can't we shift something that's already duplicated and shift it from treatment to prevention and work on something that the Singapore government is trying to achieve, to shift from healthcare to health? So with the same money, you're able to do this because what we've done is tell clients, if you buy your insurance through our brokerages, which is why I bought brokers, you get the platform for free. What happens with the company? So it's anonymized for each employee. The employee can only see their own information. It's aggregated for the company. Everyone complies with data privacy rules, so you can't share this information. But if the company gets aggregated, anonymized data, they can actually see a profile of their entire workforce in each country and focus not just on the healthy, but now can focus on the unhealthy and the at-risk, and actually know what types of programs are needed. Is it diabetes? Is it hypertension? Is it nutrition? Is it weight management? And be able to correlate the data. So we score every single individual with a health age versus their real age. If your health age is much higher than your real age, you have some bad habits, just like that age face. But if you aggregate that across a company with a health score, we can actually predict the next 3 years of disease prevalence if you do nothing. And using that data, we can predict the next 3 years of insurance and healthcare costs. So it opens up the black box for companies. If you can actually improve your health score with these interventions, we have a reinsurer who is helping us. They are willing to lower your costs. You can start containing your costs. So not only is there a defined contribution mechanism to control the costs, but here's an ability to reduce costs by knowing exactly what you need to do. We're also working with tech companies to correlate whether better health equals higher engagement, especially if you work on the mental health piece. Does it equate and correlate with better customer service? Does it correlate with higher performance? We don't know, but we'll find out. Where is the ROI? It's only with data and AI that we can get there. So now we've taken 600 companies away from the global American and global European companies, even as a startup. But now it's the next evolution. What if we can create a platform that actually can help small and medium enterprises? What if there's a way to bring the cost of acquisition down? What if there's a platform that can actually sell simple versions of life and health to small companies, and their employees can actually get the apps with a wallet to transfer and redeploy some of their treatment money into prevention money? Because dual income couples also work for small companies as well as multinationals. So now the largest banks, the largest telcos, the largest insurance companies with hundreds of thousands of SMEs and other size enterprises will white label our platform. It's the bank platform so that they can also offer it to their enterprises as actually a bundle so that they can help their enterprises who've taken loans from them or insured with them, help them reduce the rising costs of healthcare by improving worsening health. What's in it for them? The data we have now, if we have health scoring data, the bank has credit scoring data, the telcos have geospatial location data, and because we run benefits, we actually know the pivotal times when an individual joins a company, when they leave a company, when they get married, or when they give birth, because we have to cover their dependents, and we have to actually move them into the platform or remove them. So for example, if you just got married, you may need a home loan. Why? Because no one is going to marry you in Asia if you cannot get a home. So you need this. So with this data and the ability of AI, we're actually looking to be able to pay for prevention with just the cost of treatment within workplaces that are not just the largest Fortune and Global 500 companies, but also for the smallest companies. So now banks, telcos, insurers can actually pinpoint the right time to sell the right product to the right person with the ability of AI. Thank you.